Hello and welcome to Magna Wave Office Hours AM edition on this Tuesday morning. My name is Pat Zemer. I'm the CEO of Magna Wave. I'm here every Tuesday morning at every Tuesday, 9 a.m. in the morning and again 2 o'clock in the afternoon for office hours. It's a time when I'm available to answer questions about anything related to PEMF therapy, devices, training, anything like that you'd like to ask. I'd be happy to do that. Complementary therapies to PEMF, how that relates, and that's a very good question. I need to get into that. I was asked that just the other day. So I'm glad you're here with us today. I've been doing PEMF therapy since 2002. I've been doing high voltage PEMF therapy since late 2006 and early 2007. So we've been at this type of practice and this type of services for many years. And so we've got some idea of what's going on, but we're always learning and we're always ready to listen and gain information from folks that are out there. So again, if you have any questions, post them here on the page. I'd be happy to answer them for you. I do want to get into a couple of things, and sometimes to me it seems, oh my gosh, we're going to answer that question again. But we are continually asked about frequency. What is the frequency of the Magna Wave devices and how is the frequency adjusted? We all have in our mind this idea that frequency, and it is this as well, so it's a little confusing, but we all have in our minds that frequency is like you take like the dial on the old cars when I was growing up, or when you punch the button on the new cars today, you can move to a different radio frequency, 107.6, 109.2, whatever that frequency may be, and you pick up that radio station, or same thing on a TV station. You go to 32.1 and bingo, you have your station that you want to watch. Frequency is also the repetition by which something occurs. How frequently do you see someone? How frequently does this happen? How frequently is the signal delivered to the recipient, whatever that, what is the frequency of receiving your mail? You receive it every day, rain, snow, shine, whatever it happens to be. That's the frequency with which we become accustomed to receiving our hand-delivered mail by the Postal Service. So people ask the question, what is the frequency? And the reason they ask the question is because some companies have devices that they control by frequency. And so they control the frequency of delivery, which we do as well, but they'll control it and they'll say, well, we can come way down here to do this and way up here to do that, and they'll have a particular number on their dial or a particular setting on their dial for that particular frequency that they're discussing. And so does that mean that it's better than anything else? Yes or no? We don't really know. As a matter of fact, Bob Dennis, in a recent report that he was just published recently in a magazine, talks about we know what magnetic therapy does, but we don't really know to this day how it does what it does when you get down to the microbial and the mitochondrial level of the cells of the body. They really haven't studied that. They're seeing what the results are, but they really have not studied to this point as to what precipitates this action to occur. And that's the same thing in a lot of different drugs that are out there. And not that this is a drug, but a lot of different medications that are out there. You've heard of medications that were approved by the FDA to do this, and then all of a sudden 2 years later they find out, whoop, the side effect is doing this because this happens in the body that they really didn't study at the beginning. I mean, to do that would, for everything, and we've got a very arduous situation with the FDA in the United States, if they took everything back to the minute place it would be, nothing would ever get approved because they'd still be trying to figure out as they dig deeper and deeper. But back to the frequency situation. So various companies talk about frequency with their devices. And we do too, except frequency on our devices is the rate of delivery. No more. It's not a 13.2 or a 29.7 or a 30 frequency this. It is the rate of delivery. If someone wants a fast rate with us is a lower powered signal, then they turn it to where it's clicking very fast or it's delivering rapidly. But that's not a frequency, again, that we look to. Now there's companies that are combining other forms of frequency, whether they use light, whether they use, let me turn that down, whether they use light, whether they use music to produce frequencies that are absorbed by the body, and then particular things can happen. And when you have that, for example, sound frequency, there's a lot of discussion today about sound and music and how it affects the body and what it does at the cellular level. Same thing. There are some studies, but there's that the relaxation we get with music and how it allows us to be more receptive to other things going on around us. Again, there are frequencies in that music. So just to try to, again, be clear, the frequency becomes, in essence, very confusing when people address what it's doing. Our frequency is rate of delivery. Click, 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 click. Someone else's frequency may be something else that you can't feel. And a lot of devices that talk about frequency are devices that you can't feel. They set them up to do this and to agitate, not agitate, but to stimulate the molecules in this fashion with this particular delivery system that they're using, and that's fine. The end result is what happens. Again, falling back on Dr. Dennis's recent article explaining the state of PEMF today, and I'm going to dissect that article and present it to you so we can all understand what it does. But he clearly states in that he's a low voltage, low frequency person from the standpoint of the devices that he has. But when he talks about that today, he talks about people say, well, you can achieve the same results with the low powered units as you get with the high powered units. Yes, you can. It's slower. That's the primary difference. Those results are slower. So if you have the time, if it works out that that's how it's delivered and that's how you receive it, and you're happy with that, that's fine. Because the low powered devices will work just fine. They're just slower. He points out in his paper or in his article that he recently had that quite often people will use a higher powered unit to get to where they want to be, and then they'll use lower powered units to move the situation along and to be a more easily used type of therapy potentially. Our therapy goes from the lowest power available to much higher power so you can rapidly reduce inflammation and reduce pain. So they all work. It just depends where you want to be in that cycle and how you describe what you deliver. And to go a little bit farther with that, the people will talk about FDA and what's approved and what's not approved. And what you find, there are devices approved for glioblastoma, for depression, for various that are PEMF devices, but they don't call it PEMF. They call it magnetic stimulation. PEMF, but they're calling it transmagnetic stimulation, so it looks different. The people with the glioblastoma situation call it something a little different. You can do that, but when you dig deep into the research, you'll find that what's happening is they're all delivering pulsed magnetic signals of varying deliveries of varying strength. And which one works the best? Well, everyone is different, and so different people receive these differently. So that's where it gets a little confusing where someone says, well, I don't see these devices as PEMF devices approved. Well, they're approved with specific descriptions, most like many drugs. The one that I often use for discussion purposes is Viagra. It was originally a heart medication, then was found to be a stimulant. They changed the color, they changed the name, they changed what it was to do. It did all of that, so they called it Viagra. And on the other side, it's a heart medication. But if you went to look for the heart medication, you're not going to necessarily find the one that is a stimulant. So I'm just trying to clear that up with regard to frequency and how that stuff goes. And so when you try to make those comparisons, it's very difficult. What you need to come down to is what the results that have been attained with particular devices, the speed with which you want to attain the results that you're looking for. And then is the device capable of doing everything that you want it to do? I read a lengthy article the other day that someone presented, but they're saying that more is not better. Well, that's true. More is not always better, and we tell our people that all the time. You don't always have to use these devices on the highest power that could become uncomfortable for someone or that you just don't need to do. We never tell anybody to do that. Don't turn it on and put it up to high and make it go. That's what a lot of folks would make you think, that these high-powered devices are dangerous and they're always high-powered and they're always this. Well, that's not the case. They can be low or they can be high. to me, from my perspective as Magna Wave, the low-power devices are great. They're all complementary. They all provide the results that you're looking for. It's a matter of speed of delivery. Can those devices deliver inflammation reduction and pain relief as quickly as our device? In many cases, they can't. Once in a while, someone puts one of those machines on. I don't mean once in a while like it doesn't happen. It's just their condition, their issue allows a low-powered machine to address it immediately, and they feel better. But if you've got something that you want to get it done and you're not getting relief from other things, many times a high-powered device will come in, allow you to get ahead of the situation, and then you can treat it however you wish. Many people get ahead of the situation and don't treat it with anything. They just relax a little bit, or they don't stress the area, and they're fine. So you can approach these in many different ways. I know I got into a little bit of a ramble there, but when you start talking about the frequency and how different companies talk about frequency, it makes it difficult to sometimes wrap your head around, because someone will say, well, our frequencies are special, and they do this. And Dr. Dennis points that out as well in his article. If someone tells you that they've got the magic frequency, or they've got the magic thing that does everything, pay attention, do your research, and make sure that you know what you're looking at, because there are situations where people will talk about magic and it's not there. These devices simply provide energy, and the body accepts that energy and better allows itself to heal itself, and many people are quickly responsive to that. Others, it takes more time. Okay, I could go on, but I want to be able to get to your questions and get on down the road. Let's see if we have a question here. How do you go about getting certified? Well, the certification, if someone comes into our family and they purchase a machine and they then are put into if they desire, put into the certification training. There are modules for human, small animal, and equine. In the certification area, you take the classes, basically. They're online classes. You watch the videos, read the materials, and then you can have a test, and you take the test. Do we currently train and certify someone outside of the family, if you will, to call it a family? We kind of look at our culture as family. No, people that are with us, because we don't want to confuse the issue with different types of machines and different types of training. We want our training at this point. Now, there has been some discussion about a magnetic or a PEMF training base that basically instructs and trains on magnetic therapy across the board, which is something that we are, in fact, looking at to see what it can be. But that's how it works. If you have a machine, if you purchase a machine from someone else and you would like to become certified, all we need to do is know that it's a machine that is like ours. So when we talk about our training and we talk about what's going on, then you can come into the training portal and purchase and take the classes in that way. Okay, let's see if there's another question here. Good morning, Tony. Okay, I don't see any other questions at this point. Let's see. Can you get this thing is hard for me to read sometimes. Oh, okay. Can we get more human-oriented version of the app? Magna Wave has an app, and that's, Ronald, thank you for asking the question, because someone else asked the question also today. We have an app for Magna Wave, and the app is currently set up to where it's general, equine, small animal, or dogs and cats. And the reason that we do not have a human version as such at this point in time, and if you go look at other apps that are out there, there's an app called Cavanti that's used by folks, veterinarians and so forth like that, that also does not have a human side of the app. The reason for that is the HIPAA regulations. And so we have a general area of the app that someone can go in and put a picture that they would like to have there, a picture of their client. They can make notes on their client, whatever type of client that may be. But when you make your app specific to a human application, then you have to fall into the area of HIPAA and how you're doing it. And then that is also regulated somewhat by, I guess, the FDA. And so at this point, people handle those situations in a generalized fashion, so you can make the notes that you want to make, and you can proceed in that fashion. We are working with our app developer, and it takes a little time to put these things together, to have the app to where if you're working on just large animals, you can turn the dog and cat section off, or you can turn the general section off. But right now, you would handle something outside of the animal realm, or a specific type of animal, a chicken, or something like that, in the generalized section of the app, and just to make that better understood. So we're going to develop this app as we go. It is our plan even to have even more, to have a specific app that will address a specific area, which we'll be able to do when we can turn sections on and off in the app. But right now, it's basically a regulation as to what is allowed in these types of record-keeping apps, and how it can be recorded, and that's why the app is general small animal, or general equine, dog, and cat. I hope that answers the question for you. Typically, when you use the app, if you have a specialized client, a chicken or whatever the client may be, and you're in the general section of the app, when you go to email that version of the report to your customer, they don't get the whole app, they get the report as to what you're doing. What you're looking at personally on the app, or your tech looking at the app, yes, if you deal only in horses, the dog and the cat in the general section are there on the screen, but you certainly don't have to utilize those if they're not the portion of the app that you're wanting to use. Great question. We're just trying to cover all of the bases with what we're doing. By the way, the app, I just got a new version of the app yesterday that's updated a lot of the terminology in the app to make it more general in how the terminology is used and expressed through the app, how the pictures are utilized from your phone or from pictures that you take. So, and I'm going to approve that version today. One last thing, we're going to try to, not last thing, we're going to be evolving with this thing over time, all the time, but currently, when you put a report in, I'm getting deep into this, when you put a report in, it's got the date that you put the report in, and that date is not editable. You would have to go to the record and say this record was updated on this date, but we're going to make it so when you put a report in, you can put the date that you want to have on that report. Again, that's for app users, and it's going to be developed as we go along. So, great question. I hope that answers your question, Ronald. And to that end, Ronald asked a question yesterday via email about someone who is having a tooth extraction, and will the Magna Wave, or can the Magna Wave be used for pain and inflammation after the extraction? And then he went on to talk about infection. Well, I'll cover this in two sections. For sure, the Magna Wave can be used in order to help reduce swelling from a tooth extraction, whether it's wisdom teeth or whatever it may be, or and to help with pain relief. Many people will use a device like this prior to this situation to help make sure that everything is in a good, healthy state. There is no inflammation there, to constrict the capillaries maybe so there is less bleeding as you approach that type situation. But when I had my wisdom teeth pulled a couple of years ago, 4 wisdom teeth at one time, what I did is I let the bleeding subside somewhat. We don't necessarily like to do it when there's active bleeding, because we don't improve blood pressure or increase blood pressure, but we do aid in blood flow. Does that mean you're going to bleed more? No, but will that kind of make it so maybe it doesn't stop bleeding as rapidly? Could. So we try to wait for the bleeding to be controlled, no bleeding, and then go and work on the inflammation reduction, which will lead to pain relief. And in most extractions, when you're talking about teeth or when they do something and sew it up, the bleeding is controlled relatively quickly. It's not actively bleeding anymore a short period after the procedure. However, when you start talking about wisdom teeth and impacted, and you dig and deep, and you can have some bleeding that can last for several hours, but you would want that to subside and then begin your treatment to relieve the pain and inflammation. The next part of the question that he had was, what about infection? If there's a potentiality for infection, do we want to treat at that point in time? Well, while it's not contraindicated, the discussion invariably goes to the point that if there's active infection in the area, we don't want to spread it or do anything like that, potentially. So what we often, what kind of ends up being on the table is let the antibiotics, let the infection-fighting things that they're doing be in place, be complete, and then step in and do the work on the body for inflammation reduction, pain relief, and to help the body heal itself more rapidly. So that's kind of the protocol that we utilize. If there's infection there, let's let the doctors deal with the infection, and then we'll deal with the help deal with the pain and inflammation after that particular time. So it was a great question that Ron asked last night. So let's see if any other questions there may be. Be happy to answer them if you have any additional questions. Some good questions that were there, and of course questions are coming up daily that people ask me to answer, and I want to bring them to the office hours to get you the answers that you're looking for. I kind of talked about the frequency a little bit, and then the high and low power devices, and certainly just to put it from the standpoint of Magna Wave, while we have low power devices, we are a high power device company with our Max, our Maya, the Pulse Pro, and the Semi machines are high voltage, low frequency devices. And when we talk about, let me kind of clear that up. When we say high voltage, low frequency, what that means typically is that we're not radio frequency devices. We're not putting out frequencies that will interfere with other machines, other devices in the doctor's offices, or other devices, your radios and your televisions and things like that. So low frequency, most of the time our devices operate between 50 and 60 hertz, and which brings it in the low frequency spectrum of the frequency spectrum. When you get up into you can get up into the thousands. You can get 1,300, 1380 on your radio dial. You can go even much higher than that when you start talking about the frequencies or the hertz delivery of the machine, which begs me to go on and say, so people will ask all the time, what is the hertz? We were told that by NASA that they use 10 hertz, and Dr. Dennis pointed out in his recent article, yes, they use 10 hertz, but that doesn't mean that 20 hertz won't work just fine, or 50 hertz won't work just fine. We don't know. You got to pick a number and go. Again, we know what the results are quite often, but we don't know what is actually making those results occur. And if somebody is not getting results with their device, believe me, they're going to try to tune their device in such a fashion that they're getting the results that they're telling you that you can expect in the manner of time that you can expect to receive them. So, very good. If you have any other questions, I'd be more than happy. I keep saying that, but I'm certainly here and happy to answer your questions, whatever they may be. Let me just make sure that I'm not missing something that could have come in at the very beginning. Let me see. Oh, there's more down here. Let me come down here. Let me get it. Well, the problem is I'm wearing a yellow shirt this morning, and here we go. Here comes. What kind of treatment time and setting with the Semi would you suggest for post-surgical inflammation? Another very good question, Ron. Actually, the Semi goes from low, medium, and high. I would say you'd certainly want to be, just as a discussion realm, if you're post-surgical, I would say medium initially. You could do low or medium, because what you want, the Semi puts out two frequencies. It's got two frequencies of signal. One is very quick, clicking that you can hear in the background, and one that's slower, click, click, click. The one that's slower is a little stronger, designed to reduce the inflammation and help take away pain. The very low one is more in the Schumann resonance area that a lot of people talk about to deliver a very low frequency of delivery or low intensity to stimulate the area. And I would say either one, low or medium, would be fine in a post-surgical type of situation to just to help the healing, to help promote the healing of the area. Could you go on high if someone's had a knee replacement or an elbow-ish situation and it's still very sore from some of the inflammation? Could you turn it up? As long as they're comfortable, you're okay. Are you going to overdo it? No, we do not increase blood pressure. So comfort becomes the key there when you're talking about it. And comfort is not an issue typically when you're dealing with the SIMI device. But just for a good, comfortable setting and something that is easy to do, I would say low or medium on the SIMI for those types of areas of treatment. Okay, let's see here. Tony, how would you treat Bell's palsy? Bell's palsy is where you get like a paralyzing effect, basically, or a drooping effect, where the face will, one side of the face will droop off and be very low. The eye will come into a drooping type of situation. So certainly what I would do is certainly treat the area. I would treat it with the large loop or the butterfly, treat it by the area. I would certainly make it comfortable. You'd probably want to use a much lower setting on the device to stimulate the blood flow, the nerves in the area to deal with it. But I would also deal with the head, the spine area up and down the back to make sure that everything is nourished, good blood flow, no inflammation in those areas to help enhance what you may be looking for in this area. You could approach that with the large loop over the head, resting on the shoulders, so the signal is going up and down. So you're getting the back of the head, you're getting the face, you're getting the shoulders and the spinal area as you're treating up and down. You could use the large loop, kind of put into a butterfly, or not a butterfly, but a hot dog configuration that you would place running up and down the spine from the high area down on your back would be another way of approaching it. And I would treat, this is one of those situations that you're probably not going to treat at one time and also, oh my gosh, it's gone. Those are very serious situations and takes time for them to heal. But you want to just basically oxygenate, nourish the body, allow the body to become nourished with its oxygen uptake, improve blood flow, can work a lot of things. But that's how I would approach it. This way, coming up and down, this way, going back and forth. Through the head and the face area, concentrate on the area where they're having the situation for them to potentially have more comfort and a quicker return to normalcy. Great question, thank you. Let's see, Simi, let's see. Bell's palsy. Shannon asked the question, let me see if I can get it here. Let me spin it. White type on this background. I've indicated, I can't see that. When treating a dog at someone's house, it starts interrupting their signal and they have to shut it off. Any ideas? Let's see what, interrupting their TV signal. Well, again, these are non-radio frequency devices designed not to do that. However, when you have your wiring in your home, for example, the wiring it can be used today. They can hook up internet devices where they use the wiring in your home as your connector from one internet device to the other. And so when you're on those types of systems and you're in somebody's home, can you get, by virtue of the wiring into the home and that you're plugged into that wire and you're using some of that power and you're causing the power is coming in and out of the device, can it cause some disruption of the TV that's in the room that you're in? Yes, that can happen on occasion. Depends on the TV, depends on their wiring, depends on their antenna signal. For example, if you're in a home and they're using an air antenna and the wire on the antenna is there, it's kind of like if you put headphones on and you're using device, the wire from the headphone can become an antenna to pick up that signal, because we are broadcasting a signal and you can hear the clicking at that point through a headphone or that type of thing. That same thing can happen. And they're designed for that not to happen, but that doesn't mean, given the wiring in a home or in that type of situation, that it can happen. And so that's, as I've said, we don't want, they're designed not to do that, but we cannot control every situation when you're doing those types of treatments, or you're in somebody's home one place from another. For example, we use that in our office to power our office phones. We use the wiring in the building with a little adapter that goes into the wall, then that plugs into your phone, then that picks up the signal that's put through the building. And different locations in the building work better than other locations because of the wiring and how the wiring is done, how many devices are on that particular wire at that point in time. Hope that helps, Shannon, but that's just the situation as it is. There are devices, back when I started, that the way you would test them to make sure that they were working is you'd turn on a radio and you'd hold it up next to the thing and it would make these noises, and so it would definitely interfere with the radio. That's because I'm talking 17 years ago, and that's just how they measured devices. They turn a radio on and hold it up next to the magnetic device. Well, over the time, we're building devices differently, so they don't do that as a rule, because we don't want to interfere with those types of devices and radios and televisions. Okay, any other questions? I'd be happy to do it. We've been going for about 40 minutes now. Some very good questions. Hope the information has been helpful to you when it comes to PEMF and how it can be beneficial to the body, and how the different devices work and how they could be complementary to each other. And quite often that's something that does come up. I'll kind of go there. What about doing sound therapy with PEMF? Perfect. What about light therapy with PEMF? Fine. Laser therapy with PEMF? Fine. Any number of things work together. Massage with PEMF? For sure. They're very complementary to each other in how we're doing and manipulating and working with the body. Let's see another question there. We have a patient that's not responding well, had bad neuropathy of the feet due to diabetes. Well, the situation there when you're talking about that, great question, Kirsten. Is it Kirsten? Krista, thank you. Great question. When someone has neuropathy, the question comes in, how long have they had it? How severe is it? What are the other elements that are influencing the neuropathy? In other words, what is their diabetes under control? What is going on with that particular element of the disease at that point in time? It's very difficult for you to gain results from something when the body is fighting it as hard as what you're doing. So if you're working, we always say don't use the devices are designed to help cool and improve circulation. So if you put something on for heat and then you come back and you treat, we're fighting each other. So if you have a condition in the body, if someone has a bone spur in their foot and you're treating the foot, you can relieve the pain on the foot, but as soon as you're finished and you're going and that person starts walking, that bone spur starts irritating the area again. So it's not we can say that someone has neuropathy and you're going to stop it or you're going to help them feel more comfortable in 3 treatments. It could take multiple treatments. Maybe need to talk about what you're doing. Are you doing just the feet? Are you doing the legs and the feet? Are you doing the spine, legs, and feet? Quite often when we treat carpal tunnel, we treat the wrist and the area and the elbow and the shoulder and the low back because everything's connected there. And so is it ending here, but yet it's coming from somewhere else, or it's being exacerbated from another direction. So, patience is the key. You can't go in and say, well, we're going to treat 4 times and it's going to be better. And we can't say that we're going to treat once a week 4 times and you're going to see a difference. In many indications, we start where we would treat 7 or 8, 10 times in a row, and then we'll back off to see how it does, and then we'll say, okay, let's do this again, let's ramp it up again, or let's say, hey, we can hold this if we treat it once a week now, or twice a week, or maybe we don't have to treat it at all unless it becomes exacerbated or becomes a problem. It's very difficult when you have to say that every person is different. Every animal is different. So how one person responds or one animal responds to this and how the next one will depends on not only the situation that we're dealing with, but all the other underlying contributory situations to that area. So that's what you need to look at there. If you'd like to discuss that further, please call the office. Let's set up a consultation. I'll be happy to visit with you and talk through that a little further about the protocol you're using or what you're doing to approach those types of situations. Remember, we do not treat conditions. We basically provide sessions to the body to provide energy to the body so the body can then set itself up to better heal itself. We can't say that we're going to go, you do this and you do that, and you're going to heal this type of situation, because we don't do that. And you have to be careful when you talk to your clients and your customers. We're not healing anything. We're just providing energy to set the body up to better heal itself. Hope that helps. If you want to talk about it further, please let me know and we can do that. Let's see. When would you treat with PEMF when a horse is getting hock injections? Well, if we're injecting into the bursa, if we're injecting into the joint that the injection is going to stay there, you can treat right away. Some people prefer to wait 24 hours, perhaps 24, 36 hours, a couple of days to let things settle in, let it do its job. There's certainly nothing wrong with doing that, because those injections are designed and put in place to reduce inflammation and to promote some healing on themselves. And then you can come in as a support mechanism, as a complementary method sometime after that. If the injection's being given as a block into the tissue, then you certainly don't want to treat, because you don't want to flush the injection out to where then it cannot do what they're asking for it to do. So you need to keep those two situations in mind. You want to talk to your client or your veterinarian that's injecting, what they're injecting, what their recommendation is. But as a rule, we typically talk about, if you're injecting a hock or injecting a joint, give it 24, 48 hours to do the job that it's doing, then you come in and support it. Again, you could treat up to the time of injection to help it along, so when that injection is administered, it has a better opportunity to better do its job, so the body can be more responsive to what was being done. But that's a good rule. Give it a couple of days, then go in and start treating. Now, if they're treating the hock, doesn't mean that you can't treat the back. If someone is having an injection in their knee, or they're injecting the knee of the horse, doesn't mean that you can't do the shoulders and the neck to relieve things. There could be some referring areas that are also having an effect on that particular part of the body, and by working the other areas of the body for comfort and soothing and energy delivery, you can help the overall situation of the body. So it just means you're going to stay away from that particular area for a period of time. Another question was asked the other day about a horse that received an injection in the neck, and there was a swelling and a hematoma, if you want to call it that, but there was a swelling at the point of injection. Once they've made the injection, it's got time to get into the blood system and start doing its job, but there's a build-up there, a swelling there, you can treat it. The injection's not there. The injection's gone. It's moved through the body as they want it to go. But the inflammation is still there, so you can certainly go in and begin treating that area, just like you would do post-surgery if someone has an elbow surgery and they've got a lot of inflammation. As soon as it's all done and everything's in control, you can go in and start working on the inflammation. Great question, Kimberly. Thank you for asking. Any other questions at this point? I'd be happy to throw them up there, and I've got my glasses worked out now that I can look a little closer to my screen. My screen's about 2.5 feet away, and it's little print. It's a little difficult for me to read. I probably ought to open it over here, actually on the Facebook page, and then I can make it easier for me to read those questions. Should probably think about that in the future when I do this. Go ahead and have my Facebook page open, and then I can read those questions in nice, bold, black print. So it's easy for read for those of us who wear trifocals, and in order to read what's going on. So, any other questions? Happy to answer them. Been on for 50 minutes now or so Thank you for joining me this morning. I'll be back at 2 o'clock this afternoon to continue to ask office hours questions. So if you have any questions at that time, please join me. If you'd like to see something addressed, because these stay on the page, if you have a question that you'd like for me to answer, send an email to magnawave1@gmail.com or patzemer@magnawavepemf.com. I'd be happy to answer your questions for you and cover them on an office hours, and you can come back and watch it later. Something else we also do is we take these particular, call them chapters or what you will, and we go through and we break them down by time segment as to what we discuss. And so you can go to the YouTube channel, the Magna Wave YouTube channel, pull up a video, works best on your computer, pull up a video and scroll below the video, and you'll see at what time on the video we're talking about specific questions, what they are, and you can actually click it and it will take you to that section of the video. So again, go to our YouTube page, the Magna Wave YouTube page, pull up a particular video, and it'll tell you what we're discussing in that video and where to click in order to get the answer that you're looking for. Great way to be able to go back and peruse these videos and pick up the answers that you are looking for. So again, thanks for joining me this morning. I always enjoy it. Sorry I was a couple minutes late this morning, but we'll be back at 2 o'clock, Magna Wave office hours, to answer your questions. So have a great morning. Thanks for being with me, and we'll talk to you later. Bye.